Called to order.
Not so hard.
I've just been asked to read some of the rules with respect to bringing items forward on our agenda. I'm to ask if anyone in the audience wishes to speak on any matter appearing on the agenda, and I think we have a couple of individuals who do want to speak tonight. If you do want to address the board, we'll ask that you stand and be recognized. State your name and address. You don't have to give your street address, but at least what city you live in. Approach the center table and either stand or sit. And that way we'll be able to hear you because of the sound arrangements we have. And then you can only speak on items that appear on the agenda, and we're allowing 2 minutes in which to speak. So we'll ask that you state the petition, the order, the ordinance, or resolution number to which you refer. So we'll start the meeting and keep to the agenda that we have. The first is to approve the meeting minutes of December 2nd, 2021. I think everyone probably had a chance to read them. At least they were sent out. I don't know if there are any calls for any revisions or if we can just go ahead and approve the minutes of December 2nd.
I read them and I have a few questions on page 2. The minutes are not numbered, but on the second page, under presentation exhibit A, it says hearings. Okay, I don't believe this was a hearing, it was a petition, correct?
Yes.
Okay, and the other thing that I couldn't quite understand, maybe it's just me, but on the third page, on the paragraph that begins, this COVID-19 virus is here to stay, so we need a little bit of humility. It didn't make sense to me when it got down to the last sentence. As humans have a right to control their bodies, including their faces, rather than be forced to wear masks forever because of an endemic virus. Okay, period. The next sentence, keeping the mandate in place devalues liberty and I wasn't sure what that word was supposed to be, P-O-S-I-T-S?
I think that means just it puts forward or it states.
Okay, maybe we could correct that if we wanted to.
Yeah, it is a word, but it's not used very much, that's right.
Oh, is it a word?
Yes, it is, yeah.
Oh,
yeah.
I didn't know that. Okay, well then if it's a legitimate word, and then we can keep it there. I just need to be familiar with it.
And I think, though, that was kind of taken from the documents that Ms. Wetchy presented to us at that meeting of December 2nd.
Okay, very good. Then the only thing I have a comment on is that it was not a hearing, it was a petition.
Right.
So other than that, I motion that we accept the minutes from, when was the date here? December 2nd, 2021, with that one error being amended.
All right, and I was fine with the minutes as well. Yeah. So we're all in favor then of accepting the meetings with that one change from December 2nd, 2021. Mr. Mayor, are you able to hear us all right?
I am, Mr. Chairman. Thank you.
Okay, just wanted to be sure.
Thank you. Yeah.
So we'll move on to the COVID-19 update for...
I don't know if we asked if anybody wanted to speak in the public forum in the beginning. We should ask that.
You mean to do that first, or because we have it in as number 5?
I don't know if there's anybody else, though, or if the mayor wishes to speak in the public forum section or in regards to a petition.
All right. Is there anyone then who does want to speak in the public forum? Does that include Ms. Wetchy, or are we speaking?
She could either do it in a public forum, or she could do it at the petition time if so asked.
I'll do it at the petition time, because then I have more than 2 minutes.
All right. Is there, Mr. Mayor, do you have anything that you want to speak on?
No, Mr. Chairman, I'm here observing, and that's the extent of it right now. Yep.
Okay, super.
Thank you.
Thanks. And Amy Jolly, is she available or as yet?
I'm on, can you hear me?
Oh, yes, there you are. Good.
Hello.
Did you want to speak in the public forum, or do you want to wait until, I think we have you coming up as item number 3. Item number 2 is
Thank
just...
you, I'm fine to wait. I didn't see I didn't have the agenda for this, so I'm fine to wait. Thank you.
Okay, super. All right, then, Steve, do you want to give a COVID-19 update?
I certainly will. Bear with me for a second. So basically, I very briefly did a little research on COVID numbers starting in 2022. Since January 1st to date, Fitchburg has seen 1,287 confirmed cases in just a little less than 2 weeks. A breakdown of that 1,287, 307 people are under 18 years old, and then 980 are greater than or equal to 18 years old. Thought that was sort of a interesting statistic. We've so far had 3 deaths in 2022 due to COVID. Our positivity rate, we've had 1,573 cases in the last 14 days, which gives a positive, I'm sorry, that's effective of January 6th, I believe. So it's a 2-week period up to January 6th. So that positivity rate would be 25.2%, which equates from 1,573 cases, 6,236 tests from Fitchburg residents.
So again, the positivity rate is 20%?
25.2.
Yeah.
And I believe the state rate is somewhere around 18 to 20%. So we are consistently, again, above the state rate.
And if I understand, our vaccination rate is around 56% or so?
So I did research the vaccination rate within the city just a few moments ago on the Department of Public Health website. That document is before you. It is a Excel spreadsheet. So I believe I highlighted that section. Yeah, it's now at 58%. So it seems like we're stuck in the 50s. And we need to work a little bit harder to try to get those numbers up. I also included information about boosters. You'll see that highlighted in the column to the far right, second to the from the right. You'll see the percentages from age groups for boosters per capita. Those numbers also are not representative of great vaccination numbers. It looks like in the age groups, the 65 to 75-year-olds are in the mid-50 range, 50% range, and then it sort of goes down into the 30s from age 50 to 64. And then it gets even low, under 20% from age 20 to age 45. So for whatever reason, folks are not getting boosters. Only 20% of our population has received a booster.
Yeah. It's interesting that the
Thank you, sir.
5 to 15-year age groups are only 0%, so no one is getting boosters at that age for some reason. It's a parental decision, I suppose. But,
Well, are they approved for under 5 at this point?
no, this is 5 to 11. No,
Oh, okay, 5 to 11.
I think in the next 3 to 4 weeks, Moderna will be approved for the 2 to 4 year age group. But still, even at that, we're from 5 years to 15 years. It looks like individuals are not going for their boosters, even though in the 12 to 15 year age group, 60% got fully vaccinated, that is 2 doses or at least 1 J&J, but they haven't been going for their boosters. Not sure why that is.
Well, how far into the booster campaign are we? I mean, we're really not, I mean, we're still actively having vaccine clinics for the boosters. So when did the boosters first start coming out? I forget, was before Christmas, but November or so? October?
I think that,
Yeah, so it's only been October, November, December, January, 4 months, I mean, that we're into giving boosters. So, I mean, the clinics have been overwhelmingly busy for boosters, so I think people are out there, but I don't know what percentage are children, but I mean, we're out straight at the clinics.
yeah, and it may be difficult because of the holidays that were, that have come along since the boosters were started, and kids going back to school might be harder to get them to various clinics or sites. But it does look as if it is something still that we need to work on to get the booster rate up and vaccination rate itself.
So, in December, I know the public schools had several clinics. I want to say at least 4, and I know each of those clinics got about 200 children. So I don't think this is a real accurate number. I think it's, obviously, it's much more than 5.
Yeah.
I don't think it's 0. I think it's much better than 0, obviously, but I know at least 600 folks did get vaccinated as part of those December school vaccination sites. So they are also offering more in January, and we will continue to get the Vax Bus out here as much as possible to have clinics for the schools to help increase that number.
Okay, super. All right, well, I don't know if that's a number that we have to vote to accept. It's just kind of informational.
Correct.
Yeah. So I think we could put that aside and move on.
So I will move on to clinics, as the COVID-19 update. Tomorrow, from 12 to 4 in this building, the legislative building, we will be hosting an adult clinic. Folks are encouraged to go on the webpage if they can and sign up for an appointment. I believe there's still appointments available, but you also can walk in. I believe we will have just Pfizer available tomorrow. We are still working on Moderna. I'm sorry, we did get the Moderna. We'll have 160 Moderna and 200 Pfizer tomorrow. How things changed in the last 10 minutes.
And it's 12 to 4?
It is 12 to 4 tomorrow. The Saturday clinic that we originally had scheduled is canceled. However, next weekend, both Friday from 12 to 6 and Saturday from 10 to 4, we will have clinics, and those clinics will be every Friday and Saturday until the end of January, and it will work itself into February as well. I'm not quite sure if it's going to be the entire month yet, but we are working on staffing those Friday and Saturdays up until the end of February.
Oh, super.
So the availability for boosters will be there in the next several weeks.
Well, that's the best we can do, I think, is make it available, and hopefully if you build it, they will come.
Correct. As far as testing sites, today was our final day at 49 Nursery Lane. We are moving the testing site and combining with the city of Leominster to the Fitchburg Airport. So from 12 to 4, starting next Tuesday, Monday being a holiday, we could not get any testers, but it will start next Tuesday. And it will be from 12 to 4 at the Fitchburg Airport. And folks would enter from Airport Road to Blueberry Lane to Cobbler Drive, which brings you to the old runway at the airport. And we, as I stated, we're going to combine with the city of Leominster. So both Fitchburg residents and Leominster residents are welcome to attend. And it's a PCR testing. And we will continue to operate until the end of March 31st, weather permitting, obviously. And that hopefully we'll have plenty of room now that we are on an airport and will not cause traffic problems in either city. So These test sites are producing 300 to 500 tests a day, depending on how the weather is and how many testers there are and so forth. But I think we're seeing the results now of the amount of availability of testing. So that's a good thing in as far as people being able to determine whether they are actually positive or not.
Yeah. And can they just walk in or drive in, or do they have to have an appointment?
Now it would be completely drive up. We are actually going to have you drive through a tent. Folks can walk up, but it would be quite a walk.
Yeah.
So if you can carpool and catch a ride, it'd be a lot easier, probably a little bit warmer for you too. But walk-ins are welcome, but we prefer you drive up. It's probably much safer that way.
But you don't need an appointment ahead of time?
You do not need an appointment, no.
Okay, super, good.
It will be on the state webpage. The state webpage can be, because it's a Stop the Spread site funded by the Department of Public Health. It's a little misleading and appears to give you an appointment. It's really just to get your foot in the door. It's not really an appointment time, like it's a little deceiving. But we now have the space to fill up the runway and make sure that testing is taken care of.
Gotcha. That's wonderful. Have you finished your update, per se, or?
The last item, I believe, is the contact tracing staffing. Since the last meeting, we have hired an epidemiologist, and we've also hired a contact tracing supervisor, as well as 8 contact tracers. So they have taken over the duties of the contact tracing in the city of Fitchburg, as well as the 12 other communities of the Montezuma Public Health Network. We're excited about that. I actually was hoping to have them come and give the presentation about the COVID update, but they were dealing with some concerning issues in Gardner, so we'll do that at the next meeting, and you'll get to meet the new epi and the contact tracers.
Okay, great. This might be an unfair question, but at the last meeting, we discussed Fitchburg State University and their vaccination status, over 80%, I think around in the 90%.
So I did speak to the president. He did let me know that there are very strong student groups that support the mask mandate, and he's continually supports it himself and did not wish to have that mask mandate removed at the college.
All right. Even though we're allowing it, but they've decided against it themselves.
They wish to have our assistance in the enforcement end of it if necessary.
Super. Okay. Thanks for updating us there. So I don't think there's anything we need to approve, is there? Or this is
That is
primarily
correct.
informational. So I think we can move on to the next item on the agenda, which is the request for variance coming from Applewild School. Essentially, I think that Applewild is becoming, at least in part, a boarding school, which is great. And so they've had to create housing for lodging purposes. And as part of that, they have to, of course, provide furniture and accommodations. I think we've had regulations going from medieval times that have dealt with the size of people back then and what people required. But I think, and I think in their first lodging at Applewild, I think they complied with that, if I understand, Amy. But I think there's now a desire to add a second kind of dormitory, I suppose we could call it. And having learned some lessons from the first, I think that they're asking that perhaps more appropriate furnishings can be made in the new dormitory. So I'll just say a couple of things, Amy, if you want to update us in terms of what your thoughts are. I'm going to need to recuse myself from the vote in this, I think, because I had 4 kids go to Applewild, and I was on the Board of Trustees as my wife was, so I think it probably I should stay out of the vote. But anyway, I'll ask you to update, what you're asking for.
So before you go, Amy, I apologize. For your reference, board members, the regulations are in your packet.
Oh, I'm sorry.
On the last pages. Go ahead, Amy, I apologize.
Sure. Yes, we are, Mr. Chairman, Committee, citizens of Fitchburg, thank you so much for allowing me to present here. On the lodging house regulations on page 4, there's some very specific requirements that are listed. And we did comply with these word for word with our first dorm. And the furniture, I think, was designed, or the regulations were designed for adults. And we have middle school students that live with us. And they aren't as big as adults, so they don't need as much room. And I found a line of furniture that actually we're really excited about purchasing. It's sort of a lofted bed solution that has a wardrobe, a dresser, and a desk, and a really interesting staircase that I could share my screen and show a picture of it.
I
but-
actually printed out, I forgot I had it. Oh, you have it?
Amy, just to interrupt, how many students will be in the new building?
We think 16,
Oh,
yeah.
great.
We don't expect the boarding program to ever be huge. We value educating local youth, and our boarding program allows us to generate the tuition income we need to offer substantial financial aid resources to local kids. So that's, we love the program for any number of reasons, but that's probably one of the top reasons why we love it so much. The furniture that we bought for our first dorm, it's fine, it's functional, but it's just huge for these kids, and it's a lot for them to keep organized. And if you look at the picture of what we're proposing, it is it's a twin extra long bed with a guardrail and actually a staircase system that goes up the side, which I think is even safer than a ladder. And then there's considerable flexibility for the student, whether they want to store the wardrobe, the desk, and the dresser immediately under their bed, or they can actually arrange it a little bit, which we think for children who are living independently, they should have a little bit of autonomy for how they organize their rooms. So, I know this is a small thing, but for our kids who live with us, this would mean a lot. So I thought I would come and see if I could get a variance for the school.
Super. As I say, I'm going to recuse myself.
Okay,
because-
all right. So I'll go ahead and we need 2 motions, is that correct, Amy? We need 2 variances?
Yes, I think so.
I motion that we amend the regulations to allow each student to have hooks instead of towel racks. And the other variance was, I'm sorry, I missed that, had something to do with the beds.
It has more to do with like the cubic square feet. I would just ask you to remove the cubic square feet requirement for the drawers.
Okay,
And,
so the motion would ask for approve a variance to remove the 16 cubic feet of dresser space and 3 feet of closet rod space from the regulations.
Perfect.
So we have 2 motions on the floor.
Yes, 2 motions.
So I'll second both of them.
Okay,
This certainly, even if it doesn't meet the letter of the code, it meets the spirit of the code. I mean, the kids are going to be taken care of. They have space for their stuff, and that's what's important.
Okay, terrific. So it doesn't matter how I would vote, I'm for it, but even if I were against it, it's still 2 to 1, so it does pass.
So I will prepare a document that shows the variance in the vote, if that's helpful,
Thank you.
in the actual
That's
code
very
that it
helpful.
varies.
Okay.
Congratulations.
much.
Yeah. Amy, just if I could ask you, in terms of the vaccination rate at Eppewild, how's that coming out, or how's that going?
So 100% of our faculty are vaccinated, and our older students are maybe grade 6 and up, because those were the ones first eligible for a vaccine. I believe we're at 80% vaccinated. We require anyone that lives on campus to be vaccinated as well. And then for the younger kids, I think we're running about 60%.
Super.
We're very eager to have a shot available for preschool students. I'm feeling really comfortable with our mitigation and everything for the school, but the little ones, you know, they're not protected yet.
Right.
So we're looking forward to that.
Yep. Great. Well, thank you for your time. Thanks for coming and informing us.
Amy,
Thank
could
you
I
so
ask you a question? I'm sorry, have you had any positive cases with the little ones up there at Applewild? You have, okay.
Yeah. And it's hard. We participate with the state stay-in tests and the pool testing program and all that the public schools do. So we have actually, you know, thanks to the Commonwealth, a wonderfully robust testing system. But the preschoolers aren't eligible for that yet. So therein lies the rub, and that makes it a bit harder.
Yeah.
Thanks.
Well, hopefully in the next month, the ages 2 to 4 are going to be eligible for vaccines, so I think that'll be helpful as well.
Yeah.
Yeah.
Yeah. Let's hope.
That doesn't
Thank
sound
you
like a
so
fun
much.
clinic.
Have a nice night.
Have to be chasing kids around. Wrestling match. Thank you.
Thank you so much.
Thanks.
Thank you.
Item number 4 then on the agenda is the site assignment review for AKS Recycling. I think we had some discussion about this at the last meeting. or 2
Correct.
meetings ago.
I believe Mr. Matthew Hughes is signing on to the meeting. I don't know if he has yet.
I am in. My camera is not functioning, so I'm sorry you can't see me tonight, but I can
that's-
see you. Hear you.
That's
Sorry to let
okay.
you down.
We hear you're good looking.
All right.
So anyway, back in August, we had a site assignment hearing. It was a minor modification, and the board allowed AKS Recycling to, the original condition was to have municipal solid waste removed from the tipping floor at the transfer station within 24 hours. We did grant the condition in amending that condition to 72 hours. So I believe in that meeting, we did ask for a 3-month review. 5 months have passed, so even better. So I've asked Mr. Hughes to come give a report on how that is going with the operation.
Well, there's my camera. I went back and looked at our records. As you know, we report on a monthly basis if we have any complaints. Also, just in being at the facility, seeing the operation, we've not had any complaints since we've gone to the 72 hours. It's worked out well for us, and we're able to operate just as we had before we got the expanded storage time to 72 hours. So no issues.
And I as well, and he does report monthly, like he says, so he's telling the truth there. And I have not received any complaints as a result of the change of operation.
So do we,
I believe we said if we had no concerns, it would automatically become a condition, but I suppose a vote to make sure that in the minutes of DEP would probably like to see that there is approval
right.
still. Am I correct, Mr. Hughes?
It can't hurt.
So should we make a motion to approve the extension of time allowed for,
Make it a permanent condition.
to make 72 hours a
Yes.
permanent condition? Yes,
Correct.
I would make that motion.
And I'll second.
I'm in favor.
So all are in favor, and
Favor.
and that passes then. Thanks.
Great. Thank you.
Perfect, that was easy.
Yes, sir.
Well, I think the last item on the agenda has to do with Jacqueline Wetchy's petition to rescind the Board of Health mask mandate adopted August 5th, 2021, and amended on August 25th, 2021. So I think you're welcome to speak on that.
Thank you, Mr. Chairman. In your COVID-19 update, you talked about the number of cases. Focusing on cases is kind of an outdated approach in the post-vaccine world and also in the Omicron world, where cases are increasingly decoupled from severe outcomes. And I don't know if Dr. Gandhi is available on Zoom. She said she might be able to speak to us today. I don't know if she's logged in, if you can tell.
I don't, not that I'm aware of.
Okay. She wasn't sure without a very specific time if she would be able to join us, but I have attached an article that she wrote to the end of your packet. And I believe I also sent it to you ahead of the meeting so you could read what is the current thinking on COVID-19 as we move to it becoming an endemic disease. In addition, you have focused heavily on cases that have been reported in the past, so you're looking backwards. But if we look forwards, we see some very good news. If you turn to pages 2, 3, and 4 of your packet, you'll see sharp drops in the level of COVID-19 in the community wastewater in Massachusetts. These are from the MWRA website. I know our wastewater commissioner here in Fitchburg has been willing to have us do similar sampling here so we would have local data. But generally, we have followed the state pattern. As cases rise in the state, ours rise. As they fall in the state, ours fall. So we see things are getting a lot better. We're over the Omicron peak, and there's no need to be alarmed. Another thing I wanted to address was at the last meeting, Mr. Murray had criticized some data that I presented. I had showed that states without mask mandates had lower rates of community transmission than states with mask mandates. He said that's because states like Florida peaked earlier from the Delta variant, so that's a valid criticism. So for today's meeting, I have on the next 3 pages presented data over the entire course of the pandemic, showing death rates per capita by state. And you will see that states with mask mandates and states without mask mandates are interspersed amongst each other. There's no pattern. It's not like all the states with mask mandates did better and all the states without mask mandates did worse. We can also see this on the national level. In the United States, our deaths per million from COVID are 2,546. In Sweden, a country that had advisories only and no mandates, their rate was just 1,495, significantly less than ours. Experts are increasingly speaking to the fact that masks, particularly if they're not N95 or KN95, really don't do much. You're infringing on people's liberty without a significant public health benefit. In addition, the mask mandate that you have in place, if you turn to the next page, is discriminatory. It discriminates against lower income people who suffer more from the $300 fine you have in place for anyone who does not comply with your mandate. I think you probably came up with this figure of $300 because according to the state, that was the fine in place when they had a mask mandate. But according to the U.S. Census Bureau, Fitchburg is much poorer than the state average. The median household income in Massachusetts is $81,215. Wouldn't we all love to make that? In Fitchburg, it's $57,207. The per capita income in Massachusetts is $43,761. In Fitchburg, it's just $27,007. Massachusetts' poverty rate is 9.4%. In Fitchburg, it's 15.7%. And we are one of the 10 poorest cities in the state for the year 2021. You turn to the next page. I've entitled it, $300 is a lot of money to a lot of people. Since the stimulus payments that were given to people at the beginning of the pandemic have been used up, a lot of people are really suffering. The survey found that 40% of Americans have less than $300 in savings. There are also particular populations within Fitchburg who are very poor and would not be able to pay your fine. Homeless people often go to the library when the weather is inclement, such as we had extreme cold earlier this week. Do you think they can pay a $300 fine if they're not wearing a mask there? Another group of people who your mandate specifically applies to is residents of the Fitchburg Housing Authority. You don't have a mandate on people living in private apartment complexes if they want to run down the common hallway to go out to their car and get something, or if they want to go to the laundry room. And these are people who can more afford to pay. But you put it on the poorest of the people in the city who live in public housing. This is a very punitive approach. And there is a precedent in public health for taking a punitive approach to people. Some of you who are as old as me may remember when the crack cocaine epidemic came out, this country launched a war on drugs. It punished people. Among other things, it led to mass incarceration, which had many negative effects, disrupting communities and families. And you know, it didn't work. Things are worse now than they were before. It's so bad that here in the city of Fitchburg, you need in your health department to have a substance use coordinator position. So I would really challenge you to drop your mindset of mandate and punish and move to one of advise and support. With COVID-19 mandates, there have been negative unintended consequences. Childhood vaccinations are down because people are rebelling against being told they need to get vaccines. Prior to the COVID-19 mandates, there was no gap between members of political parties when it came to flu shots. Now members of one political party are 20% less likely to get a flu shot than members of another political party. So there are negative unintended consequences when you try to force people to do things and when you punish them and you fine them if they don't. I do ask that you rescind your mask mandate, and if you don't rescind it, at least you remove this $300 fine, which is really egregious in as poor a community as this.
Yeah. Well, again, thank you for your comments, and obviously you spend a lot of time doing thorough research. I'm going to ask Steve, how many $300 fines have we levied since this mandate has been in place?
0.
Okay.
I would hand everybody a mask before I would hand them a ticket.
All right. So we have not really put out any fines on anyone. I think that's. It may be a bit heavy-handed, but it is a way of trying to encourage people to wear their masks. But in actual fact, we have not fined anyone, so I don't think there's been any discrimination against any particular group. Everyone still falls under the same advice, and that is to wear your mask and otherwise be fined $300. But no one has been fined, and there are people who don't wear their masks.
If I might add, Dr. Bogdasarian, we did hand out masks at the same time that we were handing out the kits a couple of weeks ago. We handed out several thousand masks, so they were intended for those folks that can't afford them.
Yeah. The other question I have for myself and for everyone, I think, is why does the Massachusetts Medical Society, why does the Department of Education, secondary education, recommend mask use in the classroom? Why do they do that if it doesn't make any sense or if it doesn't do any good? I still wrestle with that. I find it hard to say that we won't listen to what others who have access to science advise, and that we'll go on our own pathway and say, well, it doesn't really matter if we wear masks or not. It doesn't do any good. We'll let kids go to school without masks. We'll let people gather in public places without masks. I don't know how that would look when people who probably know more about it than we do on the state level have indicated that masks do make a difference and they continue to recommend them. So despite your arguments and despite your research, I would like to make a motion that we continue the mask mandate as it has been. I think that as far as the fine goes, I think it really doesn't even need addressing because it's essentially not being levied. But I would like to make a motion that we continue the mask mandate as we previously have had it placed. Even those who have qualified not to have the mask mandate, that is Fitchburg State University and I think Applewild School, have decided to continue it, again, believing that it has helped them to remain safe and to keep their population safe. So again, I make a motion that we continue the mask mandate as previously been in place since August of last year.
Second.
I'm in favor.
Okay, so I think that carries, and I think we're going to continue the mask mandate.
Along with a fine to intimidate people to doing what you want them to do.
I think it's very easy. We're handing out masks. People can wear masks. We have not levied any $300 fines. I think it just lets people know that we believe that it's an important thing that people wear their masks. We all dislike masks. You dislike them, we dislike them, everyone dislikes them. But until it's shown that, we have Omicron and other variants under control, until little kids 4 years old and under can be vaccinated and be kept safe, I think it's our duty to remain as safe as we can and to keep everyone safe. So I've made that motion, and I think it's passed that we continue the mask mandate of August 2021. And again, I thank you for your time and for helping to enlighten us. We appreciate that. I think that's the last item on the agenda.
It is.
So,
Make a motion to adjourn.
Second.
okay, we're adjourned.